So I think as we have become better at treating patients, the patients are living longer. So currently at 5 years, there are about 3.5 crores patients who have been treated for cancer or are currently living with cancer. I think cancer survivorship is all about how we help patients get on with normal quality of life, with normal day-to-day things, having gone through cancer or currently going through cancer. I think as we have treated more and more patients, we have realized that the cancer treatment itself can have late effects, and we are identifying more and more needs related to those, and we are learning from patients. So I think it's very important that for a patient to get back to normal quality of life, we address not only their physical needs, but psychosocial needs, and also their fears about recurrence, about their sexual health, their cardiac health, their bone health. So this is all that is survivorship, and we need to address them for each and every patient. So I think the role of a caregiver, a family, and a friend is very, very important while a patient is undergoing treatment, because they help them go through the treatment. To begin with, they help them come to terms with the diagnosis of treatment along with their oncologist, the family members, the help of a psychologist. They help them to come to terms with the diagnosis of cancer, which can be quite shattering for quite a few of our patients. And then also their support is vital to making sure that the patient completes their treatment. And I think completion of treatment is important, but after that, compliance to follow up is also important, because for each cancer type you have a different follow up schedule, which is very important for certain period. Like for breast cancer, we nowadays follow up patients with early breast cancer for 10 years. We used to follow patients up for 5 years. For a cancer like colon cancer, we would follow patients up for 5 years. So again, the role of the oncologist, the family, and the support groups is very, very important. At Max Healthcare, I think at most of the hubs that we have across the NCR, we have cancer support groups which are site specific, let's say for breast cancer or GI cancer. So when you see a patient and talk to another patient when you've just been diagnosed with cancer, and you talk to that patient who's actually been through the journey that you are going to go through, and to talk to that patient and see that this is who you may be a year down the line, 5 years down the line, or even 10 years down the line, I think that gives a lot of strength and a lot of hope. So I think the role of support groups is very crucial in helping the patients, and I would encourage all of you to join a site specific support group or a cancer support group in general, where you get to see patients who've been through the same type of cancer that you have. So again, volunteer program activities are slightly different in that you have like a lot of NGOs who come up with say art therapy sessions, yoga sessions, Pilates sessions, which are driven at a certain aspect of care. And I think one cannot say that the support group is usually run by patients. Let's say if you have a breast cancer support group, you would have patients with breast cancer who've gone through similar types of treatment. And a volunteer program may be where the volunteers from various parts of life would come and support patients. So we have volunteers who come and talk to patients. We have volunteers who would go to patients' home and do certain care needs, like patients who are living alone, help them with their shopping, with exercise. So you have different aspects, and each of these I think is very, very important to help support a patient cope with their diagnosis, and also handhold them to get through their treatment. So I think this is something which is asked by most of my patients. And some of the feedbacks that I've had from the patients is that this diagnosis has been life changing.